everybody, and welcome to video number 2 for chapter 12. So we're continuing with the heart. We have two circuits that flow into and out of the heart. We have what's called the pulmonary circuit, and then we have what's called the systemic circuit. And so the pulmonary circuit, you can see here all through the steps. This is basically going from, I'm going to go right to this image right here. We look at the pulmonary circuit, we're coming into the right atrium. Let me get my thing right here. We're coming into the right atrium, into the right ventricle. Then we go through the pulmonary trunk. We split into two sides because we have two sets of lungs. So we're going into the left lung here. Over here, we're going into the right lung. And then we come back into the left side of the heart there. From there, we will start what's called the systemic circuit. So if you look at your notes right here, we'll look at the systemic circuit. This is going to start from your left atrium and come all the way through to your right atrium. And so going from here, we're doing the systemic now, your left atrium to your left ventricle. Left ventricle pumps to your aorta. Your aorta is going to pump through all of your tissues. This is showing you specifically upper extremity. You can see down below here doing lower extremity. We're coming all the way back into the right atrium. So pulmonary circuit is to and from the lungs. Systemic circuit is to and from your tissues. Heart murmurs, these are abnormal heart sounds that you can hear from, and they may be a heart problem or they may just be an abnormality. Usually it's a structural defect. So usually there's like a hole. There's septums that divide your two atria and your two ventricles. So sometimes there's a hole in those septums. They call it an atrial septal defect or a ventricular septal defect. And so that can be causing some abnormal heart sounds. Looking at the outside of the heart, I'm just going to go right to this picture right here. We have coronary arteries and coronary veins. Now, these coronary veins, you will see in lab, they're called cardiac veins. So you can either use either term for that. Your coronary arteries are going to supply oxygenated blood to your heart muscle, to your myocardium. Your big ones is your right and left coronary, let me erase that, sorry. Your right and left coronary artery, and so they will branch, and they obviously have other names as they branch. And the waste from your myocardium and your deoxygenated blood will be collected by your right and left coronary veins, and those will be emptied into your right atrium with the rest of your deoxygenated blood system. What you have is what's called a cardiac cycle. There's times when the atria contract and there's times when the ventricles contract. They relax, then they contract. They relax, then they contract. When one of these chambers is in contraction, they call it systole. When they're in relaxation, they call it diastole. So you probably have heard the term systolic over diastolic, okay? And you've probably heard 120 over 80. This is specifically measuring the ventricle, specifically the left ventricle. So when this is systolic, this is when the left ventricle is contracting. 80 is diastolic. This is basically saying the amount of pressure that's on the left ventricle when it's resting. So it's usually measured in millimeters of mercury, which is a pressure measurement. All right, and so they're just showing here, right here, we're showing early diastole, later diastole, atrial systole, ventricular systole. Now, one of the things is that when each chamber is not in systole and not in diastole at the same time. Right and left is at the same time, but the atria versus the ventricles. So you can see here, atrial systole that pushes the blood into your ventricles. Ventricular systole is when the ventricles contract into those great vessels there. All right, so what's crazy about the heart is you could pick up the heart, take it out of the body, and it could still independently contract without a direct nerve stimulation. I can only do that for so long, but basically you have cardiac cells that sort of fire at their own rate. They're called pacemaker cells. They start in the SA node. We'll talk about that in just a second. But when these cells fire, they basically send a wave of electricity that moves through all of the muscle cells. And there's specialized junctions called intercalated discs that connect all of your heart muscle cells together. And so it beats as one. Yes, there will be a millisecond delay, but the heart will always beat as one. They still can be controlled by the nervous system, by their rate. They can be influenced by chemicals like epinephrine and norepinephrine that can influence their rate. So starting with I'm going to go right to this picture right here, starting with the SA node right here, we have some pacemaker cells, and they basically generate an action potential at the rate of what would be your heart rate. And normal heart rate is anywhere from 60 to 100 beats per minute. And so that's what happens is these cells, they fire, they generate an impulse at 60 to 100 beats per minute. And that wave of depolarization will travel through intercalated discs, will hit the AV node, will go down. You have this called bundle branches and the bundle of His right here, and then this will branch into what's called Purkinje fibers. And so this is just sending the wave of electricity, which will then stimulate all of these muscle cells right here. This wave of electricity, which will travel through the heart muscle, will then stimulate all of these muscle cells. And so problems with the impulses traveling through here can give an abnormal heart rate. So there's terms called a fibrillation. Okay, so when you get abnormal neurological stimulation of these muscle cells. And so there is what's called defibrillators that can sort of reset it, hoping it resets it. Now, when we measure the electricity running through the heart, we measure it through what's called an ECG or an electrocardiogram. It's commonly also called an EKG, and that is the German form of it. And so they look at a series of waves, which we had seen in lab. You have a P wave, a QRS wave, and then you also have a T wave. And so looking at this right here, the P wave represents the atrial depolarization. Usually the atria contract right after that. The QRS wave represents, I'm going to write this actually at the top. So P wave represents atrial depolarization. The QRS wave represents ventricular depolarization. Okay, and the T wave represents ventricular repolarization. And so usually, if you've noticed, we have atrial depolarization, ventricular repolarization. We're missing an atrial repolarization. It is occurring somewhere in this QRS wave, but it is very difficult to read because the ventricles are so large, so they mask being able to read that. We talk about blood pressure. I had kind of mentioned it a little bit earlier. We're looking at 120/80. It's measured using a blood pressure cuff and a pressure reading device known as a sphygmomanometer. And so this is usually taken at the brachial artery. Many different things can influence blood pressure, such as age, time of day, activity, stress, lifestyle. When I say stress, they have like white coat syndrome. So literally just getting in front of the doctor can sort of make you freak out and make your blood pressure levels rise. The highest one is systolic. Okay, so usually the magic number is 120/80. Anything less can be also indicated normal. Anything more would be abnormal. So there's various indicators in the guidelines based upon the American Heart Association to indicate what is normal and abnormal. But you also have to take into a lot of other things such as genetics, height, weight, race that also play a role in this. So the high number is known as your systolic number and the low number is known as your diastolic number. The systolic pressure is measuring the pressure of the left ventricle ejecting blood out to your blood. Diastolic number is measuring the pressure on your heart when it's resting. So all right, now moving into the lymphatic system, these lymphatic vessels, they collect sort of excess fluid around your capillaries. So if this is a capillary, I'm going to label this as a capillary. Remember, we're delivering nutrients, we're picking up waste, but there's sort of this excess fluid that sort of kind of makes its way while we're dropping off these nutrients and picking up this waste. And here is a lymphatic vessel, which wouldn't be nearby. They would pick up this excess fluid and it would be returned to your venous system, okay? So once that fluid comes in here, it's called lymph. So lymph, it's kind of crazy. This is a capillary. Capillaries have plasma. Plasma leaks out. This becomes what's called interstitial fluid. You'll hear that, interstitial fluid. Okay, and then that fluid makes its way in there, and now it's called lymph. We do have along these lymphatic vessels, we do have lymphatic organs such as lymph nodes. And what they do is they sort of monitor this excess fluid. And so they kind of look for bad guys. So basically it's like quality control, right? So they take a sample of your plasma and they take it to a lymph node and they would assess it and see if there's any bad guys in there, see if there's any disease-causing organisms or abnormal cells. And so we have lymphatic organs too as well that do this. So like the spleen, you have tonsils, you have lymph nodes. And so you do have a lot of lymphatic organs out there too as well. And basically you can get elephantiasis. This is a specific type of disease that your textbook just discusses. And so you get massive swelling and sort of, obviously we don't usually have around here, but maybe in underdeveloped countries, they would have more of an issue with parasites than we do around here. And so basically they sort of attack the lymphatic blood vessels, and it causes massive swelling and darkening of the tissues of the area. Now these lymphatic capillaries, I told you that they were around blood capillaries. They're very permeable. Lymph is the fluid that's formed in there, and they eventually are going to drain into your venous system. So you can see here we've got a collection of capillaries, and you can see these lymphatic vessels, these lymphatic capillaries in green here. They're very, very permeable. So they allow not only lymph, excess plasma, but also cell debris and other things like that can also drain into this area. Now these lymphatic vessels, they will eventually make their way up into what's called a lymph node. And a lymph node will allow lymph to flow through it. It contains B and T cells, B and T lymphocytes, which are a type of white blood cells that fight against disease-causing organisms, and also macrophages too as well. Lymphatic organs, we have the spleen. Okay, this also takes in a lot of blood, so it would be a good place to monitor for microorganisms. And the thymus plays a role in the maturation, so the formation of healthy T lymphocytes specifically. B lymphocytes specifically mature in the bone marrow from where they're born. Other places we have just like a cluster of lymphoid tissue. This would be like your tonsils. They're very similar to how a lymph node works. Peyer's patches, your bone marrow. So these are all part of your lymphatic system and your blood system. Okay, and that is it for video number 2.